Good evening, guys. This is discussion E for you. Discussing changes in the body with aging. Introduces a broad, evidence-based overview of the natural gradual shifts that occur across multiple organ systems as people grow older. It highlights how these changes affect health, daily function, and resilience, while also underscoring that aging is not a disease but a universal biological process. Why these changes occur. Aging reflects the cumulative impact of cellular wear and tear, genetic, programming, and environmental exposures over time. Cellular repair shows down so tissues recover less efficiently from injury. Hormone production and regulation decline, altering metabolism, sleep, and energy balance. Metabolic processes become less efficient, reducing the body's ability to generate and use energy. Psychological reserve diminishes, meaning older adults have less capacity to bounce back from stressors like illness, surgery, or extreme temperatures. These changes are gradual but can compound, making the body more vulnerable to disease and functional decline. Major body systems commonly affected: musculoskeletal system, muscle mass and strength decrease, sarcopenia, bone loss, density, and joint stiffen. This raises the risk of frailty, falls, and fractures. Cardiovascular system, arteries stiffen, blood pressure tends to raise, and the heart's ability to pump efficiently may decline. These changes increase the risk of hypertension, heart disease, and stroke. Respiratory system, lung elasticity decreases, chest wall stiffens, and the cough reflex weakens. Breathing becomes less efficient, and infections like pneumonia, pleurisy pose greater danger. Nervous system, reflexes slow, balance becomes less steady, and memory or cognitive processing may change. Some individuals experience forgetfulness, while others face more significant decline. Immune and metabolic systems. The immune response weakens. Immune uh, immuno sense making infections harder to fight. Metabolic changes alter how the body processes nutrients and medications, increasing sensitivity to drugs and risks of diabetes or weight fluctuations. Sensory systems: vision, hearing, taste, and smell often decline, affecting communication, nutrition, and safety. What these changes look like day to day. For many older adults, these shifts manifest as reduced stamina and slower walking speed, more frequent fatigue, need for rest, altered sleep patterns, lighter, shorter sleep, changes in appetite or digestion, greater sensitivity to medications, alcohol or temperatures extremes, difficulty with fine motor tasks or balance. The page emphasizes that these changes vary widely. Some people remain vigorous well into advanced ages, while others experience more pronounced decline earlier. Practical implications for care and prevention. Healthy aging strategies can mitigate many of these effects. Exercise, strength training, balance exercises, and aerobic activity help preserve muscle, bone, and cardiovascular health. Nutrition, adequate protein, calcium, and vitamin D, and hydration support resilience. Medication review, regular check ins with clinicians reduce the risk of drug interactions and side effects. Some safety modifications: grab bars, good lighting, and clutter free spaces prevent falls. Preventative care. Vaccinations, screenings, and regular checkups catch problems early. Attention to small changes like difficulty with daily tasks, repeated falls, or new confusion can prevent larger crises. When to seek medical attention. Not all changes are just aging. Warning signs that require prompt evaluation include sudden or rapid decline in mobility or independence. New or worsening shortness of breath or chest pain, unexplained weight loss or appetite changes, acute confusion or delirium or memory loss, repeated falls or loss of balance. These may signal treatable illness rather than normal aging. and timely medical care can make a critical difference. Okay, guys, takeaway. The phrase changes in the body with aging points to a known reality. Aging brings predictable biological shifts, but their impact depends on lifestyle, environment, and medical care. With proactive prevention, adoption, and vigilance, many older adults can maintain independence, vitality, and quality of life well into later years. Okay, guys, that is your E for tonight. Now I have one more show. What I'm going to do is I'm going to take a small break and I'll be back on with F shortly. For now, Gator Wellness, take care, folks.